I'm Dr. Janie Grumley. I'm a surgical breast oncologist and the director of the John Wayne Cancer Institute. As part of the Margie Petersen Breast Center, for those patients who have been diagnosed with breast cancer, we have a multidisciplinary approach to our cancer patients. Twice a week, we have multidisciplinary clinics in which we actually bring all the physicians together at the Margie Petersen Breast Center to see the patients themselves.
The John Wayne Cancer Institute and the Margie Petersen Breast Center has a unique collaboration. We provide high-level patient care in the hospital in the clinical setting, and we can couple that with translational research. The clinicians provide a lot of questions that the researchers and the scientists across the street at the John Wayne Cancer Institute are able to answer.
What we identified in our laboratory was a new technique to identify if this treatment is going to work or not, only after one cycle of chemotherapy. That clearly will save time for the patient and also avoid unnecessary toxicity from the chemotherapy.
The John Wayne Cancer Institute invented a technique called the sentinel lymph node biopsy, which was initially used in melanoma but quickly adapted into the breast cancer field, where it allows us to test for the first draining lymph nodes, and if those are negative, then we can avoid the invasive surgery. So then there are patients who come to us with either a known diagnosis of cancer or an abnormal finding on their mammogram or ultrasound. For those patients, we provide care in a multidisciplinary approach to treat their breast cancer. I never want a patient to feel rushed when it comes to this. I think they see that, and that gives them hope and courage to fight this battle.
Once we come up with a treatment plan, then we can move forward. We have nurse navigators that actually navigate all of our patients so that they know exactly where they need to be and when.
I am helping patients navigate through this whole sea of what cancer looks like. Having that go-to person really helps alleviate some of the anxiety that they're feeling.
One of the biggest things that I'm interested in is something called oncoplastic surgery. So oncoplastic surgery combines cancer surgery with plastic surgery techniques. There's nothing more gratifying than for patients to tell me, I feel like I look better after cancer than I did before. We want to be able to keep the patient as healthy as possible, even beyond cancer treatment. So we have nutritionists that will help guide them when it comes to making good decisions about nutrition. We have mindfulness that's done by Becky.
The mission of the Margie Petersen Breast Center is to provide coordinated care to every patient who enters our doors. Because of generous donors, we have been able to provide the Willow Sage programs, including nutrition and my services, free of charge. In the early days, we were thrilled that we could treat cancer and cure some of the early cancers. And then we had side effects we needed to manage. We have mastered many of those things. So we have new discoveries of new agents, but we also have, through the years, learned that this patient in this bed needs our whole person support.
We make a difference in patients' lives by offering them this personalized care service, not only just taking care of their medical needs, but also their emotional needs, and not even with just them, with their family members as well.